So we'll begin with today's session on Allen's keynotes. Yesterday we discussed four remedies: cactus, lobelia, and tabacum, and also digitalis. So these remedies act more on the circulation, heart, and the blood components. Today we have another set of remedies which also act so deeply but more extensively on the circulatory system as well as the nervous system and the gastrointestinal system, no doubt. So the remedies are veratrum album and veratrum viridi. One of the veratrums, which is veratrum album, is too frequently prescribed, whereas veratrum viridi is less prescribed. So we'll see in detail what is mentioned in Allen's keynotes, and I'll put in my views and how I have used it, and then we can come to an understanding about how and when you will give these remedies in your practice. So for veratrum album, the first line that we see is that it is suited for children and old people and extremes of life. If you have been attending my Allen's keynotes study streak in the last 30, 35, 40 days, which is happening every day regularly at this hour, you must have seen, and of course, if you also have read the Allen's keynotes from your own study, extremes of life is a very important component mentioned in the Allen's keynotes in certain remedies somewhere or the other. And if you make a note of these things, this will go to help you in prescribing. So here we have something that is extremes of life. We saw this in also Ithuza, we saw this in opium. It's also useful in lycopodium, and now today we have it in veratrum album. For children and old people, extremes of life, persons who are habitually cold and deficient in vital reaction. So, in some of the remedies, we read that there is mentioned it is deficient in vital heat, whereas in veratrum album we see deficiency of vital reaction. So, the whole system has collapsed. Why will there be a deficiency of vital reaction? Because the system has totally collapsed and there is no energy left. And you can see it is useful for young people of a nervous sanguine temperament, which is very nice. So we saw this also in ferrum metallicum. So in this way you will be able to understand the remedies which work on different type of people, different mentality of people, and how you are going to employ them. Adapted to diseases with rapid sinking of vital forces, complete prostration and collapse. So you have a patient who is almost collapsed in the bed, who is lying. When you either see him in your OPD, he comes and sits, but he does not sit, he just goes and lies down. That is the weakness, or he'll drop in the chair. If you are called for home visit, you will see that the person is lying on the couch or the bed and there is no energy left. There is complete prostration of the vital forces. That will be indicative of white veratrum album. And the first thing that you should check in such a case is that whether the forehead is cold, whether the body is cold, whether there is any perspiration which is kind of hot or cold. And you will find out if it is cold, it is more predisposed to work in the favor of veratrum album. Okay, so cold perspiration on forehead, if it is entire body, it is tabacum. We saw this yesterday. If it is just the forehead, we see that it's there veratrum album for you. Cannot bear to be left alone, yet persistently refuses to talk. Now comes next another symptom which is very integral and has multiple ways of understanding. So let us see what the symptom is. The symptom is thinks that she is pregnant or will be soon delivered or will soon be delivered. Okay, that is the word mentioned. So if you see that these words mean that he assumes that something is there out of nowhere. He will make ideas, he will feel that he is uh, pregnant, he is blind, he is sick, and that is what he does to put a false narrative in front of different people so that he can gain the work which is needed to be done or find his way out. We'll see what type of people will do this. Okay, we'll find it out. There is a mania with desire to cut and tear everything, especially clothes, which is also there in tarantula, with lewd and lascivious talk, and it is more of amorous or religious talks. The other remedies are tarantula, hyosamus, and stramonium. So you know these type of children who are bordering towards destruction, and they are not listening to their parents. They are always uh, tearing things, breaking things, and making a fuss of whatever toys they have. Those are the children that will require veratrum album. You should also think of Hyoscyamus, Stramonium, and Tarantula on those lines and try to differentiate from the characteristics that we need to find out. Then you have attacks of fainting on the least exertion. Carbovage and sulfur are very close. Opium is also another remedy which has, suddenness, and it will also have more of heat. Whereas veratrum album, we see that it has more of cold. Excessive weakness, attack of fainting from least exertion, sinking feeling during the hemorrhage. If it is sinking feeling during uh, the fainting, then it is trillium pendulum. Sensation of lump of ice on the vertex with chilliness, the other remedy being sepia, as of a heat and cold at the same time in the scalp, as if the brain were torn to pieces. Face is pale, blue, collapsed, features sunken, hypocritic, red while lying, becomes pale on rising up. The other remedy is aconite. So the entire circulation is kind of frozen, and when the person tries to rise up, you will see that there is, you know, paleness because the blood doesn't seem to circulate. It has got stagnancy, or it has developed a kind of a frozen action where no movement is there or very less movement is there. Thirst intense, unquenchable for large quantities of cold water and acid drinks, wants everything cold. So someone who is cold externally should take something warm to balance what is happening inside and outside. But if he asks for cold, that would indicate veratrum album very strongly. Craving for acids or refreshing things, they will ask for juices, they will ask for something that refreshes, like the remedy phosphoric acid. Icy coldness of the tip of the nose, face, feet, legs, hands, arms, and many other parts. So, or at one time there was mentioned that there is icy coldness of the forehead, and if it is entire body, it is tabacum. But on the other hand, in the physical journals, we see that there is a different parts which are mentioned which are icy cold. So, what is interesting in veratrum is that you will see that there is a tendency to attack different parts, and whichever parts are affected they become cold. That is what is the speciality. It will mostly be certain parts that become cold, And in this way, you can think of veratrum album. There is a cold feeling in the abdomen also. Colchicum and tabacum are very strongly indicated. Violent vomiting with profuse diarrhea, vomiting with excess nausea, great prostration aggravated by drinking. Arsenic is another remedy. And if it is by least motion, it is tabacum. Great weakness after the vomiting. So I have posted one case on the timeline of Instagram and also Facebook, where it mentions that this patient was having vomiting episodes every 5 minutes, and they were almost ready to hospitalize this patient, but they just thought that they will call me and let me check. I just went and I saw that he was rushing to the basin again and again to bring the vomiters out. And what was interesting was that he was coming and sitting. He felt he was sitting under the fan. He was pretty cold, especially the forehead was cold and there was very much cold sweat. But he used to rush to the pass the vomit again and again. So I've described that case in a good write up on my timeline. You can go and watch, and you will find out what happened further. Next you see is cutting pain in the abdomen as from the knives, cholera, vomiting and purging, stool profuse, watery, gushing, prostrating after fright, the other remedy being aconite, diarrhea which is frequent, greenish, watery, gushing, mixed with flakes, cutting colic with cramps commencing to the hands and the feet and spreading all over. Then there is prostration after fright, aggravated on least movement with vomiting, cold sweat on forehead during and prostration after. So during the event they will have cold sweat, and after the event with episode whichever is affecting them, they will have uh, prostration, which is also there in arsenic and tobacco. And on the contrary, there will also be stasis, which is constipation, no desires, too large, hard. The other remedies being bryonia, sulfur, and if it is in round black balls, it is chelidonium, opium, plumbum. If it is from inactive rectum, it can be indicative for veratrum album. Frequent desire is felt in the epigastrium, like the remedy ignatia, and if the frequent desire to pass the stool is felt in the rectal region, there is tenesmus, it is nux vomica. Constipation which is painful, especially in children and infant, after lyco and nux have failed. So we can think of opium if there is hot perspiration, we can think of veratrum if there is cold perspiration. These components when you bring together will give you the medicine which is veratrum album. Otherwise there will be no scope of prescribing veratrum album in constipation. Next you have is dysmenorrhea with vomiting and purging of exhausting diarrhea with cold sweat. Ammonium carb and bovista are the other remedies. The patient is so weak in dysmenorrhea that he can scarcely stand for 2 days at each menstrual cycle. Alumina, carboanimalis and cocculus are the other remedies. Bad effects of opium eating, tobacco chewing. We saw that in tobacco also. We saw this in lobelia. We saw this. We will see this in another few remedies also. In this way, you can consider this remedy as well for such patients who are addicted to tobacco. Pain in the limbs during wet weather, getting worse from warmth of bed, better by continued walking. In congestive or pernicious intermittent fever with extreme coldness, thirst, face collapsed, face cold and collapsed, skin cold and clammy, great prostration, cold sweat on forehead and deathly pallor on face. So all our books have given some or the other indications for fevers. How do you see fevers in a gist, but it's very non-descriptive. You will need something more elaborate your for you to understand, and that is what why I have come up with the fever workshop. You can join it, and it will be segregated into different components, which is very important for you to understand how to take a case, how to understand the medicines, how to prescribe, and going down the line you will see before after cases and videos. So next we have is comparison, where veratrum album can be compared with arsenic, arnica, china, cuprum, ipecac, and after camphora in cholera and cholera morbus, and after ammonium carb, carbovage, and bovista in dysmenorrhea with vomiting and purging. Aggravation from least motion after drinking, before, during menses, during stool, when perspiring he has aggravation, and after fright there is aggravation. Often removes the bad effects from excessive use of alcohol and tobacco. Next we go to is a very less prescribed veratrum, which is veratrum viridi. If you see the seat of action, there is mentioned that it is suited to people who are full-blooded plethoric. There is congestion, especially to the base of the brain, and the chest, spine, and the stomach are affected. So you have violent pains which are attending inflammation, and you will have rheumatism, you will have circulation problems, you will have congestion, which will cause these issues of circulatory distress. So you have acute rheumatism, high fever, full hard rapid pulse, severe pain in the joints and the muscles like bryonia and salicylic acid, scanty and red urine. The child trembles and jerks, and he is threatened with convulsions, continual jerking and nodding of the head. So all those cases who have childhood epilepsy, we think of all these smaller other remedies. Veratrum viridi can be thought if it is having this specific congestion in the base of the brain and pulse, which is very characteristic, and there will be coldness in the body somewhere. Next you have is nervous or sick headaches, congestion from suppressed menses, intense almost apoplectic headache with violent nausea and vomiting. So both the veratrum compounds you see album or viridi will have nausea and vomiting as a concomitant and extension in the different areas of presentation of complaints. Next you have is congestive apoplexy, which is nothing but a kind of a stroke. This is an old terminology. Hot head is there, bloodshot eyes, thick speech, slow and full pulse, hard as iron. So there is coldness, or there is kind of a congestion somewhere else, and the pulse is fulminant and striking the finger all the time like a belladonna pulse. So you can see veratrum album will be suited to more people who are kind of having cold attacks, and veratrum viridi will be suited to people who have hot or hot like feeling with a strong pulse. In veratrum viridi you have convulsions which are with dim vision, bacillar meningitis, and the current virus which is going on, which can be very strongly where we can think of veratrum viridi, the Chandipura virus. And head is retracted, child is on the verge of spasms. Cerebrospinal diseases with spasms, dilated pupils, tetanic convulsions, opisthotonus, cold clammy perspiration. In cases of sunstroke, there is fullness of the head, throbbing of arteries, sensitive to sound, double or partial vision, and there is the other two remedies, gilsimum and glonine, which are similarly indicated. In veratrum viridi you have the tongue which is white or yellow with red streak down the middle, and dry, moist, white or yellow coating, or no coating on the either side and feels as if it is scalded like the remedy sanguinaria. Pulse is very characteristic as I conveyed earlier. In veratrum viridi it will increase or decrease suddenly, or it will decrease below the normal. It will be, it will, there will be a variation. It will either be the extreme low or extreme high. So you can see it is irregular, it is soft, weak and intermittent like the remedies digitalis and tabacum. Veratrum viridi should never be given simply to bring down the pulse or control the heart section, but like every other remedy on the totality of symptoms which are very indicative. So we come to end of two vital remedies, veratrum album and veratrum viridi. Veratrum album will act more on the gastric areas. Through the gastric area, it will cause lot of action, whereas veratrum viridi will act more on the back of the brain, and from there the entire action begins. Once you understand it, your job to prescribe becomes easier based upon the case that is presented to you in your clinic. So that's all from today's session on Ellen's keynote study streak, and we'll continue with this tomorrow evening 5 p.m. And I guess in 10 or 15 days we'll soon finish this, and next we start is uh, the fever workshop, which begins from 15th August 2024, every Thursdays and Fridays from 5 p.m. to 6:30 p.m. And there will be a work every Thursday and Friday, which on the those days we will be doing the workshop. Those who wish to join can drop us a message, and we'll send us the link to how to join.